Stinging nettle, a herbal plant that has been used since ancient times, is very common in various countries. But is it true that this plant can overcome diabetes and high blood pressure? Let's take a deeper look at the health benefits of stinging nettle. Stinging nettle is a traditional herbal remedy that has been used in medicines since ancient times. Egyptians used stinging nettle as a natural remedy for arthritis and lower back pain. It has also been used as an effective way to warm up in chilly environments by the Roman army. The name Urtica dioica comes from the Latin word uro, meaning to burn. That's because its leaves can cause a temporary burning sensation. The leaves have stinging hairs that also produce itching, redness, and swelling. However, as long as dried, freeze-dried, or cooked stinging nettle has been processed into supplements, it can be safely consumed. Studies show that it may provide a number of potential health benefits for you. Here are 6 pieces of evidence that show the many benefits of using stinging nettle. Stinging nettle contains an abundance of nutrients. Stinging nettle leaves and root have a wide variety of healthy nutrients, including vitamin C, vitamin A, and vitamin K, as well as several B vitamins. It also contains minerals such as calcium, iron, magnesium, phosphorus, potassium, and sodium. Research found that stinging nettle also contain amino acids, polyphenols, beta-carotene, lutein, luteoxanthin, and other carotenoids. Some of these nutrients act as antioxidants within your body. Antioxidants are a type of molecule that help protect cells from damage caused by free radicals. They not only increase the lifespan of cells, but also protect against the development of cancer and other diseases. Studies indicate that stinging nettle extract can raise blood levels of antioxidants. Stinging nettle may reduce inflammation. Inflammation is the body's way of healing constantly and fighting infections. But chronic inflammation can be hard to manage and can cause significant impairment. Stinging nettle is a plant that contains elements that may reduce inflammation. Stinging nettle can suppress the body's production of various inflammatory hormones, as shown in animal and test tube studies. There have been some human studies which have shown stinging nettle cream to be an effective option for people with inflammatory conditions, such as arthritis. For instance, in a 27-person study, it was shown that applying a stinging nettle cream onto affected areas of the arthritis caused less pain than a placebo treatment. In research out of East Carolina University, people taking a supplement with stinging nettle extract had significantly less arthritic pain. Additionally, they felt like they could reduce dosage of their anti-inflammatory drugs because of this capsule. Stinging nettle may treat enlarged prostate symptoms. Nearly half of the 51+ age range in men have an enlarged prostate gland. An enlarged prostate is commonly known as benign prostatic hyperplasia or BPH. Scientists aren't sure what causes it, but it can lead to a significant amount of discomfort during urination. There's some research to suggest that stinging nettle may help treat BPH for people with a certain genetic marker. Animal research has shown this powerful plant can stop testosterone from converting into its more powerful form, dihydrotestosterone. Stopping this conversion can help reduce prostate size. Studies in people with BPH have shown that the use of stinging nettle extracts can help with short and long-term urination problems without the side effects associated with other treatments. In spite of this, it's not clear how effective stinging nettle is when compared to conventional treatments. Stinging nettle may treat hay fever. Hay fever is an allergy that triggers the lining inside your nose. Stinging nettle is a promising natural treatment for hay fever. Lab testing has shown that extracts from stinging nettle can work to inhibit year-round allergies. This includes blocking histamine receptors and stopping cells from causing allergies. However, human studies note that stinging nettle is only slightly better than a placebo at treating hay fever. While this plant may prove to be a promising natural remedy for hay fever symptoms, more long-term human studies are needed. Stinging nettle may lower blood pressure. 1/3 of Americans have high blood pressure. High blood pressure can lead to other serious health problems, putting you at greater risk for strokes or heart disease, which are two leading causes of death worldwide. Recently, studies have shown that stinging nettle is effective in treating high blood pressure. There are a lot of animal and test tube studies that show that it may help lower blood pressure. One of the benefits is that it might stimulate nitric oxide production, which helps to relax your blood vessels and dilate them. Stinging nettle also has compounds that may act as calcium channel blockers, which reduces contractions in the body. This relaxes your heart and gives you a more active lifestyle. A study has shown that stinging nettle could lower blood pressure levels and also increase the antioxidant defense of the organs. However, additional human studies are needed before recommendations can be made. Stinging nettle may aid blood sugar control. Studies with both humans and animals have shown that stinging nettle lowers blood sugar levels. This plant contains various compounds that may mimic the effects of insulin. In a recent study, 60 people were given 500 milligrams of sting nettle extract 3 times daily for 3 months. They found that their blood sugar levels were lowered by an average of 29% compared to those who took the placebo instead. There are many benefits of stinging nettle that are still being researched and show promising development, including reduced bleeding, improved liver health, natural diuretic, and wound and burn healing. Consuming dried or cooked stinging nettle is for the most part harmless. Although you might be tempted to handle nettle leaves, it's better to take care around them. The barbs on the leaves can prick your skin and make it sore. These barbs can inject a variety of chemicals, such as acetylcholine, histamine, serotonin, leukotrienes, and formic acid. These compounds can cause rashes, bumps, hives, and itchiness. Drying and cooking the stinging nettle leaves may remove these irritating chemicals, but of course it should still be consumed in moderation to avoid side effects. Pregnant women should avoid consuming stinging nettle because it may trigger uterine contractions. Adding stinging nettle to your routine couldn't be easier. It's available at health food stores, or you can grow it yourself. You can buy dried or freeze-dried leaves, capsules, tinctures, and creams. Many people have taken to using nettle ointments, a safer natural alternative to osteoarthritis, for its pain-relieving properties. Dried leaves and flowers can be steep up for an enjoyable herbal tea, while their leaves, stems, and roots can be either cooked or added to soups, stews, smoothies, and stir-fries. Don't eat fresh leaves, as they can be full of barb that are irritating to eat. Currently, there is no recommended dosage for nettle products. However, the following doses are most effective for the following conditions. For enlarged prostate gland, take 360 milligrams of root extract per day. For allergies, take 600 milligrams of freeze-dried leaves per day. In order to understand the safety and appropriate dosage of nettle, please speak with your healthcare provider. Thank you for watching. Please share this video with people who may need it. Be sure to subscribe if you are interested in the world of herbs.